And first thing we do is the Pledge of Allegiance, so I'll start that off. I pledge allegiance to the flag
of the
of the
United
United
States
States
of
of
America,
America and to the republic
for which
for which it stands, one
one
nation,
nation,
under God, indivisible,
indivisible,
with
with liberty
liberty
and
and justice for all. Thank you. All right. Sheila, if you wouldn't mind doing a roll call for us.
Sure. Miss Bernard,
Here in Birmingham, Oakland County.
Mr. Cohen,
Here in Royal Oak, Michigan.
Mr. Furman,
present from Troy, Michigan.
Dr. Guadalupe,
Here in Oakland Township, Michigan.
Dr. Hans,
Here in Bloomfield Town, Michigan.
Mr. Lindemere,
Here in Waterford, Michigan.
Miss Namie Dyer,
Here from Farmington Hills, Michigan.
Miss Newman, Miss Root,
Here in Rochester Hills, Michigan.
Dr. Taub,
Here in Bloomfield Township, Michigan.
Mr. Torres,
Here from Waterford, Michigan.
Mr. Landsman.
Here in West Bloomfield. Thank you. Next item on the agenda is the approval of the board meeting agenda. So I'd ask for a motion for approval of the agenda with its stories that inspire, the acceptance of the meeting minutes, the general board agenda, the consent agenda, other business, board reports, director's report, public comment, board comment, and adjournment. Is there a
Motion
motion?
to approve the agenda.
Thank you.
I'll second, Sarah.
Thank you, Sarah. All right, so we have a motion by Eric Lindemeyer, second by Dr. Sarah Guadalupe to approve the board agenda. Is there any discussion? Hearing none, all those in favor say aye.
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 Any
Aye.
opposed? Hearing none, the motion for the board agenda passes. Next item on the agenda is the public comment.
We do not have any public comment submitted at this time. I just want to remind any of our guests online, you can submit public comment on our website, or you can type your question in chat and our customer services team will respond to you. And we will have a second opportunity at the end of the meeting.
Thank you. Next item on the agenda, I believe, is our stories that inspire hope. Tonight it's with Sacred Heart, Sacred Heart Rehab Center, and that would be with Keely Sapko, our director, or their director of residential services. So you have the floor, Keely.
Hi, everyone.
Hi.
Good evening.
Good evening to all of you. My name is Keely Sapko, and I'm the Director of Residential Services at Sacred Heart Rehabilitation Center. So we're going to do a really quick presentation and an introduction to our speaker tonight. His name is Kevin. So can we do next slide, please?
Can you see the slide with Kevin's name on it, Keely?
I can. Can we do the next one? Thanks. Okay, so Sacred Heart's mission, our rich legacy of charitable service as reflected in our mission statement. Sacred Heart is dedicated to assisting people with behavioral health issues, including those with limited means, to improve their quality of life. So we really do the best that we can to reach out into the community and remove the stigma regarding substance use and co-occurring disorders. And one of the ways that we do that is by having recovery homes. So we can go to the next slide. And this slide lists our core values: integrity, accountability, customer service, and diversity. And I'm going to introduce Kevin. He's on the call. He's going to share some of his story. He is the recovery house manager for our Oakland recovery house in Madison Heights. So I wanted to give him a really good introduction. So I talked to some of the staff about Kevin and what they thought of him. And they said the following quotes: Kevin's a solid leader. They witnessed a total personality change in Kevin from when he came in till now. He's responsible, honest, and self-aware. He's done a lot of trainings on his own to further contribute to his own success. And he's made a complete transformation. He's a productive member of society. So we're really proud of Kevin, and I hope he's really proud of himself. So we're going to go to the next slide, and Kevin's going to share his story with us. Kevin, you might be on mute. I just spoke with him and he was on this, he's in this meeting. So I'm wondering, Kevin, are you there?
We can see him.
You can see him. Can you guys hear him?
No.
No, can't hear him.
All right, let me mute myself. Hang on.
If he's having trouble with his computer, Keely, he could always call in and you could help advance the slides.
Can you give me that number, please, Sheila?
The number is 248-462-6341.
All right, give me 1 second, okay?
Wait, he's going to need the conference ID. Hold on.
Okay, I'm so sorry.
That's okay. I'm just like, wait, he's going to need
My phone
something
was
else.
making that horrible noise. I'm so sorry. Okay.
That's okay. We got it. All right, 625-974-239, and then the pound sign.
Dinah, you might also want to copy it into the meeting chat.
Okay, so it's 625-974-239 in the pound sign.
That is correct.
Okay, and the phone number is 248-462-6341.
That is correct.
Okay, give me 2 seconds.
And then it is in the chat for you if you need to reference it too.
Okay, thank you. Okay, he should be calling in any second. I just gave him the information. I apologize for that.
No worries at all. Technology.
I know he was planning to use his phone for this meeting too, so I'm wondering if that's not why he's having difficulty.
This is Steve. On Kevin's image, it says that he's muted. Right next to his name.
I did bring that up the first time that I said, Kevin, are you muted? I wonder if he missed it.
Okay. Can you guys hear me?
Yes,
Oh, we can.
Yes, yay.
We are there. Okay, how's everybody doing today?
Very well.
Okay, awesome. All right, so my name's Kevin. Through Sacred Heart Recovery Home, I've been sober now for a year and 4 months, but this was far from my first attempt to get clean. This is just the first time that it worked. There's many reasons I failed to stay clean, but one was a lack of stability. To have a stable recovery, you need to have a stable place to reside. I would go into a rundown rehab for 30 days. After that, they kick you out, and pretty much they just say good luck. Knowing at the end of the month I'd be homeless again, I think, what was the point of staying sober? But if I had a stable place to continue my recovery at, maybe I'd have a better chance and I could find some kind of balance. Another reason I'd relapse time and time again, it was the absence of accountability. I had no one to check in with, no one to keep me honest. And the greatest thing about this recovery home is that your housemates can keep you accountable for your actions. They let you know when you start to fall off, and nowadays I'm kept accountable by my mother, my pastor. I have a whole team of people that I can rely on to be here for me, to support me, to help get me through it. Lastly, that brings me to another failing point. I didn't think I needed support to stay clean, so I slipped, and I tried again without support, and then I would slip again. As people, we don't like to admit that sometimes we need a pat on the back to feel a sense of accomplishment, or for someone to say that they're proud of you or that you're doing a good job. But we do. It's just a human thing that we do need, and especially in recovery, you're feeling your lowest. That is when you need it the most. Support is a big part of my recovery. When I went into the recovery house initially, it felt amazing for people to tell me they were proud of me and how great I'm doing. The same people that I hurt during my addiction are now my biggest supporters. And that is an amazing thing to have. Especially here at the house, every new guy that comes here has support that they never had before. We gather around each other. We all become a part of each other's recovery, so that we can help get through it together and maybe have a fighting chance of beating this addiction that's out there. There's a few things that changed that got me to where I'm at right now. I had to live a completely different life. All the stuff that I did before, it wasn't going to fly this time. It just wasn't. After 7 inpatient rehab stays, I realized I had to make changes in the way I was trying to recover. They say the definition of insanity, doing the same thing but expecting different results, and that's exactly what I did every single time, except this time. I came to a conclusion that to beat this addiction, I needed something more than myself. I wasn't strong enough to beat this alone. I found that out a lot of times. I called on my forgotten higher power. I called on God to rescue me, to help me from destroying all the people I love. My religion gave me the strength to take the next step. After that, it was the MAT program. God, combined with the MAT program, has been a lifesaver in my recovery. One of the main reasons I would use it because I couldn't fight the cravings. I wasn't stronger than the urge. A lot of people, they see methadone, especially, as just another drug. People would tell me I was just switching, methadone for heroin, but it's so much more than that. It's a tool in my sobriety. It's a tool the same way that coping skills or therapy is. I read that people on medicated assisted treatment, MAT, are 4 times more likely to stay in inpatient rehab. So I think even if it gives someone a 1% higher chance of staying clean, it is definitely well worth it. So I started methadone, and I found God, but there was still one roadblock: my mother. She was always there for me, and I can't picture my life without her. She never gave up on me, even when I was at my worst, when I was taken from people, when I just did everything wrong. She never gave up on me, and probably the reason I'm still alive today. But she was also my biggest enabler. And that happens a lot. Someone that loves you so much that it can become toxic, and my mother knew that. The greatest thing she ever did is she started attending Al-Anon groups, Al-Anon family groups, actually. It's a 12-step program for those who are affected by someone else's addiction. She supports me so much that she was willing to take time to go to these meetings so she could have a healthier relationship with her son. And I'm extremely grateful for that. And now I have an amazing amount of support because she was able to do that. So at this point, I'm on MAT. I found God, and I have amazing support in my recovery. But being sober, I had a lot of free time now. I wasn't out there chasing. And when you're using, that's all you do. It's all about getting the next fix. But being sober, I had a lot of free time, too much free time. They say too much free time plus boredom is a recipe for relapse. I knew that I wanted to help people in my new life, whether in the church or in the recovery community. So I started taking courses on biblical training, theories on different approaches of therapy, criminal justice courses. I became ordained as a minister. I started building my skills, which gave me purpose and pride in my new clean life. You know, in the streets, you can build skills, but trust me, that is nothing to be proud of. In early recovery, we feel pretty low because we're dealing with all these bad things that we've done out there, and they don't go away. Even if you can't remember it at one point, it comes back to you and it stays in your head. So when you're clean, you have to deal with all the stuff that you did when you weren't yourself. So we feel really low. So if you can do something that helps build you up, builds up your self-esteem, your pride in the way you feel and think about yourself, that is something that I think is essential to recovery. And it definitely was for me. So now I'm on MAT. I found God. I have great support, plus I'm building skills that I'm proud of. But day in and day out, I'm miserable at work. I dreaded showing up at 7 a.m., contemplating quitting, which is a terrible mindset to have in recovery. You can't think about stopping something without giving a heads up, because that's not being accountable for the situation you got yourself into. So it turned out my uncle was having surgery, and he wouldn't be able to take care of himself. He needed someone to come take care of him. Someone to help him get dressed, prepare his meals, clean his house, you know, and doing this felt so rewarding. I now had a job that I felt good about, so I made it legitimate, and I became a direct care worker. I gained 2 more clients and started a career that would impact my sobriety positively. It's a lot easier not to use when you're happy with your life and you're happy with what you do. I relapsed many times because of a bad job where I was just completely miserable, and it affects your entire being. Lastly, after I was on MAT, became a Christian, had strong support, started building skills, I found out that the clinic had a recovery home for MAT clients, which is Sacred Heart. They had a recovery home. At the time, I was at Turning Point Recovery Home, and I knew if I stayed there, I wouldn't last long. I wouldn't stay sober because of how unstable and toxic the environment was. Sacred Heart Recovery House was a missing piece to my new life. It gave me support, accountability, stability. SHRC is a safe place where everyone is MAT, so judgment is very scarce because everyone's going through the same thing you're going through. In recovery, especially in the beginning, we need a safe place to lay our head at night, a safe place to deal with the temptation and stress we encounter throughout the day. If I had a really rough day and the devil was on my shoulder, I mean, if I really wanted to use, if I had to go back to an unstable environment, I would definitely give in, hands down. And then everything I've done in my recovery, everything I just named, all that hard work will be gone. So it takes all these pieces to have a good recovery. You can't just change one thing. You have to change everything in your life and fit it together like a puzzle. Next slide, please. Okay. So my old recovery house was just that. It was a house. People came in and out, and I mean fast. I mean 24 hours, 48 hours. They weren't looking for true sobriety. They were looking for a place to crash. In fact, matter of fact, you can only stay at that recovery house for 3 months. There was a time limit. After your funding ran out, they didn't accept private pay. So after that, you had to leave. If you're trying to stay clean, the last thing you should have to worry about is where you're going to be staying in just a few months. Now, that's what makes Sacred Heart Recovery Home different. This place can become a home where you know that as long as you stay clean, you have a safe and clean place to be. Another big difference is the freedom you're allowed. Find out what's right for you and your recovery. At the other house, you had to join AA and do the 12 steps. It was mandatory for your stay there. I've never done well with AA, but I had to do it while there. Once I came to SHRC, they told me there is no definitive program to succeed in recovery because everyone is different. You know, just because this works for this person doesn't mean it'll work for me. With this new freedom, I was able to try a different program called Smart Recovery, and it really appealed to me, and it helped out a lot. I was encouraged to do this because they saw me as an individual, not just as a number or part of a group. They saw that every person was different and needed different help. Of course, first coming, I was terrified. Naturally, we're afraid going into new situations. But once I met the staff, once I met the people in the house, my fears went quiet pretty quick. On your first day here, Paul, the peer recovery coach, helps you come up with a plan for your recovery. It's not just words on a piece of paper. He becomes involved in your journey. You don't get that in other places. You don't get a sense that the staff genuinely cares. But here you do. So now this is me. I was once a homeless heroin addict. I mean, dude, I was destined to die in the street, especially statistically. Now I'm an ordained minister at Madison Heights United Methodist Church. I help senior citizens for a living, and I'm the house manager at a place that has saved my life. And I thank you for giving me the chance to speak. I'll take any questions if anybody has any.
Kevin, thank you so much for sharing your story. It's pretty amazing. I'm
Thank
looking
you.
for hands up. Eric?
Hi, Kevin. I just wanted to congratulate you on your, what do you say, you got 16 months clean? That's great work. I just got my 12-year coin the other day. I've been in recovery for 12 years. So I appreciate your story and understand the struggle. It's great that you found, a place and are giving back. You know, it sounds like you're really committed to service to others. And, that's an important piece in recovery is to provide service to others because addiction is such a selfish disease. So just congratulations. I know it's a lot of hard work and best wishes going forward.
Well, thank you so much. And 12 years, that is amazing. That's what I strive to get to eventually, man. And you're an inspiration, that's for sure. Thank you. Thank you for those kind words.
Just take it one day at a time. You'll get there.
One day at a time. That's what they say, right? How I do.
Are there other board members with questions or comments? John Paul.
Thank you. You had an inspiring story. I enjoyed listening to it and hearing it. And I think there are two things that you talked about that stuck out to me was your support system with your mother. And I think that that's something that is so important that those of us that surround individuals, whether substance use, mental health, that support system do what they can to understand and to learn more about what's affecting their loved one. And I think that it really hit home for me when you talked about your mother and about how she went to the Al-Anon meetings and really wanted to be able to help you. And, you know, being an enabler is can be a difficult thing, especially for a parent, but being there as that support to help get that individual to a point is an awesome thing. So I really appreciated hearing you talk about that. And then, you know, congratulations on your experiences, using those experiences that you had to help others, you know, to do something good and to share your story. I think that that's really important because, you know, those of like myself sitting on this board, you know, I've never had a substance use problem, but so I may not understand it at a level that maybe you or an Eric might. And I think that that's an important thing because it opens our eyes to different parts of it. And you know, I've worked with more with specialty courts and substance use courts, mental health courts, and drug courts over the years. But you and your experiences is fantastic. So you know, just congratulations to you. And I guess I'd ask you, you know, ordained minister, you're doing all these great things. So what do you see for your future then? What are some of your goals for the next few years? You're doing so much already.
Oh, my goal is to definitely become more involved in the church. Right now, I'm the young adult minister there, and I do 2 sermons a month at the church, and hopefully I'll be able to, you know, go to my own church one day. I hope for that, and also to become a peer recovery coach at Sacred Heart. I would love to be able to do that, to be able to give back to the place that essentially saved me. That would be an amazing thing.
Awesome. Congratulations.
Hey, thank you. Thank you very much.
Adam Furman, I thought I saw your hand up.
Yep, I just want to echo what John Paul said a minute ago. Just congratulations, Kevin, on your wonderfully inspiring story. It took a lot of hard work, and I know it's ongoing. And also just a big kudos for giving back to your community in so many ways. So thanks again for sharing your story.
Oh, no problem. Thank you all for having me. It's the first time I actually said my story like that, and you know, and it's great to be in a place where people actually want to hear it. So thank you so much.
Yeah, Kevin, before you drop, this is Jonathan. I'm always amazed at the journeys that people have traveled. You mentioned that you went through 7 rehabs, and I can't even imagine the level of persistence or tenaciousness you have in keep pulling yourself up and keep striving to find that thing that's going to help you get there. So I just I'm impressed, incredibly impressed by that. So thank you.
Yeah, I mean, you never really know. I mean, you never really know until it's too late that you're doing the wrong thing in your recovery, because there is no handbook to it really. You know, there's suggestions, there's books you can read, but every person is different, and you know, and that's why I try to remember with every guy that walks through the recovery house now, the house manager, that you know that even if they do relapse, if they come back here, I can't judge them for that, because look how many times it took me. But thank you.
All right.
Thank you.
Well, thank you.
Any
other questions? All right,
oh,
thank
sorry.
you.
Go ahead.
Oh, that's quite all right.
So we're going back to me. I just
Yeah.
have a short presentation about Sacred Heart. Do you have time to hear that, or do you want to stop here?
Please continue.
Okay. Go ahead and go to the next slide, please. So I just wanted to kind of touch base on the leadership team at Sacred Heart. I followed the template that was sent to me. I'm the director of residential services, but we also have a director of outpatient, Rebecca Steenberg. Our medical director is Dr. Romanik. We have Tammy Murray as our administrative assistant and recipients rights officer. Esty Weber, vice president of marketing and information technology. Linda Spear, the vice president of clinical services. Pam Ardwin, our CFO, and Paula Nelson, our CEO. Next slide, please. Okay, so the services that we provide in the Sacred Heart locations are withdrawal management, residential services, women's specialty services, outpatient medication-assisted treatment. We do HIV and AIDS care, prevention, recovery support services, and even a couple of our locations service the adolescents. So this is a map I actually stole it from one of our brochures of all of our locations and where they're located, and they're actually split up by color code, and it shows you like the little dot on the map is the color for what the service is. So like purpley maroon color is our residential services. The lighter purple is our women's specialty, and then the rest of them are outpatient. They're mostly blue, so that's outpatient and medication-assisted treatment facilities. Our locations in Bay City and Saginaw do the HIV/AIDS prevention, HIV and AIDS care and prevention. So go ahead and go to the next slide. So our recovery homes, we have the one in Madison Heights, and that has enough room for 6 men. We have 2 recovery homes in East Point, which have 6 men, 6 beds each, and that one is also for men. We have 1 in Benton Harbor that's also for men with 4 beds, and then we have a really big recovery home attached to our Port Huron outpatient, and that's for females, and there's 12 beds. And then we have grant-funded family apartments in Port Huron as well. Go ahead to the next slide. So like I said earlier about Sacred Heart always trying to remove the stigma of substance abuse out of the community, some of the things that we have advocated for and were able to obtain were our Hopeful Hearts program. We're partnered with Henry Ford in Macomb County and Hurley Hospital in Flint. And basically what that is a support group for women who are pregnant. We had a lot of our pregnant women coming to Clearview, which is our women's specialty program, and stating that they did not have very good experiences giving birth. And so basically Our medical director, we teamed up with Henry Ford and McLaren, or I'm sorry, Hurley and Hurley and Flint. And we have a support group for pregnant women. So our peer recovery coaches attend, and nurses and a couple of doctors, and they just answer any kind of questions that the pregnant women may have. And then basically we partner them with the OBGYN, which leads to a more, just more pleasurable birthing experience where the clients don't feel stigmatized. And then we do the MAT services in the Oakland County Jail, Macomb County Jail, and St. Clair County Jail. I don't know if any of you have seen the news over maybe the last 5 or 10 years. There's just been, more deaths occurring in the jails in general, believing probably it's substance use related or withdrawal related. And so we advocated to get into the jails and offer Vivitrol, Suboxone, and methadone for the clients so that there would be less of a chance that they would have to withdraw while they're in the county jail, which that to me is a huge thing for our community, because when these clients get out of jail, they're set up with services to continue, and it promotes them being able to be successful. It goes from a punitive punishment to restorative, being able to give them this treatment while they're in jail and then transition into the community. Next slide, please. So that's really all the presentation is. Does anyone have any questions for me? Okay. I do want to thank Kevin, if he's still on. I really enjoyed hearing his story and working with him to learn about, I'm the director of residential services, so I don't oversee the recovery homes. So I don't know Kevin, but I really did enjoy talking to him and getting his feedback on just his ideas of the recovery house and his journey. I thought it was absolutely amazing. So I really appreciate all of you taking the time to hear us this evening, and I hope you have a wonderful week.
All right. Thank you so much, Keely, for arranging this and setting this up with you and with Kevin. Thank you.
Yeah, no problem. Thank you.
All right. I'm not seeing any hands, so I don't think there are any other questions on this topic. But again,
Okay.
thank you, Keely.
All right. Thank you. Bye, everyone.
All right. Next item on the agenda is the acceptance of meeting minutes, meeting reports. Is there a motion for both these 4 items?
This is motion to accept.
All right. Thank you, Eric. Is there a second?
Second.
Thank you, Adam. Is there any discussion on the meeting minutes? Hearing none, all those in favor of approval of these 4 items, say aye.
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 Any opposed? All right, the motion carries. All right. Next item on our agenda is the actual general is the regular agenda, and first item on here is the board executive chairs. So let me pull my notes out. Here we go. All right. So my board report for May 2021. Our executive committee did not meet for virtually or otherwise on May 5th, which is our usual standing first Wednesday of the month, and that was due to a scheduling conflict. However, we did exchange emails to review and set the schedule for the COW for tonight's board and for next week, Thursday, May 27th study session. I also connected virtually with our CEO, with Dana, regarding the City of Troy's emergency order, last week's Metro Region meeting, which was on May 13th, and as well with regard to the CEO evaluation process. So for those that may have missed it, but I don't think you have, by now, Troy City Council has decided to rescind their emergency order. That means that we will revert back to the state's Open Meetings Act that allows hybrid OMA sessions. Okay, that is effective this coming May 24th through the end of this year. And then after that, the way the law is written, I believe that we are now back to the in-person completely come January 1st. So tonight's meeting is virtual, but again, after the 24th, which would include our study session, it's hybrid, meaning your options for the study session are meet virtually, citing your reason, military or health, and with health, your location. In person to be there, but please RSVP with Sheila so that we can make reasonable accommodations. Okay, if you have any questions on this topic, please reach out to myself, Dana, or Sheila. If they're operational questions, Sheila will address them. If they're legal questions, they'll go to our chief legal advisor. That's Kalana Ali. She's back from vacation. Okay. Next item was the Community Mental Health Association, CMHA. We had our Metro Region meeting last Thursday. OCHN hosted the meeting. The agenda covered, primarily it covered the 298 topic with Alan Boulder, who's, I think he's the assistant director there, handles legislative support. He provided a lot of insights into what's happening in and around Lansing. He also covered the Senate and Senator Sharkey's tentative legislation and the House tentative legislation. So I know some of you were at it, but some of you were not. There is no pending legislation that's been introduced for consideration. So now is a good time to reach out to CMHA or go to their website to find the voter voice so that you can reach out to your state senator or state rep. Okay, again, these are our state senators and reps, not our federal senators and reps. Okay, and the last item on that I'll cover is the OCHN CEO evaluation of Dana. So I'm hoping that all of us got an email in the last couple of weeks. Certainly others in the public eye that are on the mailing list, the OCHN distribution list, received an opportunity, an email to participate in a 360 survey. It's a brief survey. When I mean brief, I think it was 8 questions long when I did it. So these are due this coming Friday. Again, this is a 360. This is getting perspective from the board, from people who we serve, from family members of who we serve, from providers. So if you would like to get a survey, and the public, if you'd like to, reach out to customer service, and they will make sure that if you provide them your email, they will provide you the link to the survey. Board members, if you have not received the link for the survey or you can't find it, please reach out to Sheila and she will pass the link to you. Again, it's due on or before Friday the 21st. All right, that concludes my chairman's report. Next up on the list would be our Policy Management Committee Chair's report, and that would be by Dr. Sarah Guadalupe.
Thank you. Good
Thank you,
evening.
Sarah.
So I'm going to be going over our policy management report from our committee of the whole meeting on May 10th. During that meeting, Marquita Massey, our quality management director, provided the quarterly update. So a status report was provided on 2 goal areas. The first being the audit and accreditation. So the status of the NCQA preparation efforts. And secondly, the MDHHS contract compliance. That was current work towards meeting compliance with the home and community-based services, the HCBS standards. Secondly, Q1 performance indicator rates, and then the Q1 corporate compliance activity. So in terms of audit and accreditation, this is to ensure ongoing compliance with the National Committee for Quality Assurance, the NCQA accreditation standards. The document submission date is going to be May 31st, 2022. There will be an on-site review in July of 2022. And some of the current activity highlights include practitioner credentialing, organizational credentialing, utilization management denial audits, and care coordination. Next, meeting MDHHS compliance, so particularly focused on compliance with performance indicators. Performance for the quarter ending 12/31/2020 will be submitted, or was submitted, March 31st, 21. OCHN met the 95% standard for all indicators. Indicator 1 was timeliness inpatient screening. So looking at logic adjustments with that. And then with indicator 2, it's timeliness from first request to assessment, and the standard was removed. And lastly, in terms of contract requirements with regards to MDHHS, looking at home and community-based services, the compliance due date was extended to March 2023. And our current activity is confirmation of heightened scrutiny status, compliant validation verification, and heightened scrutiny review committee validation. And that was it for the policy component. Thank you.
Thank you, Sarah. Are there any questions for Sarah? All right, hearing none, we'll move on to the Business Operations Committee Chair report by Eric, please.
Thank you, Jonathan. I'm actually going to I've got two items to report on. One is, our financial trends as I report on each month, and then the second has to do with website development that I believe will turn into an action item that we need to take action on. Like Sarah, I'm reporting regarding the Committee of the Whole meeting from May 10th, and I'm really summarizing the report that Anya, our CFO, had provided at that meeting. As many are aware, what we do is we do a financial comparison trend from 2020, and we always do a look back to compare how we're doing compared to the previous fiscal year. So obviously in this case, it would be fiscal year 2020. And at the committee of the whole meeting, the board did review the previous monthly financial reports that had been presented back on April 12th, 2021. And one message that we always try to make sure that the community understands is that good financial oversight allows transparency in our financial position, so that we make sure that financial services are available for persons served. So there are a few points I'm going to talk about. Trends. I'm going to talk about the comparison over the previous year, and then there's a pilot program that I think is exciting that OCHN is undertaking. But as far as trends go, our revenue is still showing an increase from the previous year. The eligibility trend is also showing an increase from this time in 2020. As far as assets go, our cash and investments are up, and our receivables are showing an increase. Our capital assets are showing no major increases. And then 4, our liabilities are down significantly, and they know no major changes in employee payables or our long-term debt. When we do a comparison over the previous year, we actually see that net income is up by $28 million from the previous year. When we look at expenses, there have been no major increases. OCHN's provider network payments have increased due to the payment of the direct care wage, and hospitals showing an increase, which Anya plans to review frequently. And then 3, our net position. Our total assets are showing an increase and liabilities are down, resulting in a positive net position. So that's really good news for the organization. And then the third point is that Anya provided the board with a fairly high-level overview regarding a pilot program that we have for the raising direct care starting wage. And I don't know if Anya or anyone wants to expand on that issue. I think that it's important that the community understand that we're taking a leading role in trying to help improve the direct care starting wages in the community. Should we take review and discussion on that issue before I move to the website development?
That would be fine, if there is some.
Okay, it doesn't look like there is any. Thank you. So at our committee of the whole meeting, again, back on May 10th of 2021, Diana and Christine had made a presentation to the committee of the whole regarding our website development. And as OCHN has grown as an organization, you know, our needs to improve our website have grown as well. We hadn't done an RFP for several years, so it was decided to issue an RFP and find out what the best solution for OCHN was going to be. OCHN staff is seeking approval to enter into a 3-year agreement with Civic Plus with an amount not to exceed $125,956.96. There are a few important points. for everyone to understand. The first is that OCHN issued a request for proposal for website development and administration in November of 2020. We received 12 responses, and 4 vendors were invited to give verbal presentations. Civic Plus was recommended by the review committee for the following reasons. User-friendly solutions and tools to make managing the website easier. I mean, managing our website and making that easier is important. They have extensive government experience. The cost was reasonable and competitive. The website gets redesigned every 4 years without extra cost, and they have an ability to deliver a provider directory with additional features. And so those were all advantages that Civics Plus had over the other organizations that had replied to the RFP. So there is a cost breakdown over the 3 years. So year one, the cost would be $83,913. Year two, the cost would be $12,501.30. Year three, the cost would be $13,126.37. There is a 15% contingency of $16,429.17 built in to the cost. And so the total agreement is $125,956.96. And that's the report on the RFP for the website development.
Thank you. Is there a motion to approve this or to approve this RFP contract award to Civic Plus?
This is Steve. I move. So move.
All right. Thank you. Is there a second?
It's Sarah. I'll second.
All right. Is there discussion on this motion? I see John Paul, your hand up.
Yeah, thank you. I originally reached out to the administration with some questions about the RFP when I saw it at our study session, our committee of the whole. I wanted to just get a couple more clarifications on some points. But what I did find out was, yeah, we did have the 12 responses, 4 vendors that were more comprehensively looked at. Of the 4, this particular vendor was a lower rate by about $25,000. They were $125,000. I think the others were in the $150,000 range. But as we know, that's not always the cheapest isn't always the best, right? But I was also able to get confirmation that this vendor has had some extensive work with other governments outside of our state, with entities or governmental organizations like our own, and that there is some experience as well within our administration of having worked with them in the past, which is a good thing. There's they've been through it with this organization before, so it was. I feel comfortable with the bid, more comfortable than I did at the committee of the whole, and I appreciate Dana and a few of the others helping me with clarifications and some of the questions that I had. And as Eric was saying, is that the website design is a huge thing. It's all part of this communications, getting the word out, especially in today's day and age in a pandemic where everybody's looking at everything online. One of the questions I also did have, I wanted more clarification on, was the availability to transition from a computer to a smartphone, from smartphone to a tablet. I know an iPhone, if you open up a website on an iPhone, it might look different on on an Android, as it might look different on a tablet, as it might look different on a computer. So it sounds like this company is well versed in that and is able to tackle those challenges, because we want to make sure that our those we serve are able to get connected in that way. And nowadays, I don't know what the statistics are, but I know in my community, when we did this on my school board, it was something about nearly 70% of our community, when we ran a survey, does not use a computer or a laptop to access those schools or the website. And I think probably something similar in this as well. Most people use their phones and then tablets or other devices. So there's a lot of, it sounds like there was very comprehensive, thorough, a lot of questions asked in this RFP, and I sought more information on it. And I appreciate Dana and the others for being so responsive and getting me that information so I could make an informed vote. Thank you.
Thank you, John Paul. Are there others with questions or comments? I just wanted to make one comment on the topic. I think that our current website design was, it's been in place since we've been, while we were OCHN, and now that we're OCHN, maybe it is time for more than just a screen scrape, if you will, so a redesign. So I am looking forward to this as well, assuming this motion passes. If there's no further questions or discussion, I'll call the question. I think we need to do a roll call because it's over $100,000 and it's just good transparency. Sheila?
Mm-hmm. And Dr. Tom? I'm not sure if you're muted.
Yes.
Dr. Hans?
Yes.
Mr. Furman?
Yes.
Miss Namie Dyer?
Yes.
Miss Newman? Dr. Guadalupe?
Yes.
Miss Root?
Yes.
Mr. Cohen? I'm not sure if you're on mute.
Can you hear me now?
I can, yes.
Okay, yes. My answer is yes. Sorry about that technical difficulty.
All right, thank you. Mr. Lindemeyer?
Yes.
Miss Bernard?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
I vote yes as well. Thank you. The motion carries. Eric, is there anything more to your presentation and report?
There is not. Thank you.
All right, thank you. Next item on the agenda is the RRAC board appointments and recommendation. And I believe that Vicki Suter, who's our Director of Rights and Advocacy, is on the call to make the presentation.
I am. Thank you, Jonathan. Thank you for the opportunity to present. Our Recipient Rights Advisory Committee interviewed 5 individuals, and we're very excited about the quality of our applicants for our 3 vacant positions. And so, we had some tough choices to make, but the interview process went well. And we did choose 3 individuals. We do have 1 community member at large position available and 1 applicant for that, and that was Judy Summers. All of you are very aware of Judy Summers and how spectacular an advocate and a proponent of rights that she is. So the Recipient Rights Advisory Committee certainly unanimously recommends that she join as a community member at large to the RRAC committee. Additionally, we had some 2 positions for either individual served or a family member, and we are recommending 2 individuals, Hunter Parker and Miguel Quintero. Again, we were so impressed with these 2 applicants and so excited that they're going to be joining us. So Mr. Parker really thinks that it's important to advocate for people's rights and teach them how to advocate so they can advocate for the rights. He's very knowledgeable about resources in the community. He was talking to us about transportation resources and how to try to get around. So I think that he will just be a great addition to the Recipient Rights Advisory Committee. And then Miguel Quintera, again, he was so passionate about when he talked to us about his experiences of advocating for his own rights and having other people learn about how to advocate for their rights as well. So he just feels it's really important that people can have their voice heard, and they can't have their voice heard if they don't really know what their rights are. So again, an individual with great passion, we'd be really excited to have him and Hunter as a part of our Recipient Rights Advisory Committee. So the two of them were unanimously recommended to be a part of the RRAC. So we are asking that the board approve our recommendation of Judy Summers, Hunter Parker, and Miguel Quintera.
Thank you, Vicki. Is there a motion to approve that recommendation of the three of them for Hunter Parker, for Miguel Quintero, and for Judy Summers?
I would make that motion, John Paul Torres, to approve the Recipients' Rights Advisory Committee recommendation before the board.
Thank you, John Paul. Is there a second?
I'll second that, Jonathan.
All right, thank you, Adam. Is there any discussion on the motion? Yes, John.
I just wanted to add a little more because I sat in on these interviews as the Recipients' Rights Advisory Committee representative for the board. Impressive candidates. It was hard to choose really because all the candidates were so impressive and brought different credentials and experiences to the table. Miguel, he talked a lot about knowing your rights and how he's been treated badly in the past, but knowing how to defend yourself. And I think that he was very passionate about that, which I really enjoyed hearing him say that about being able to get educated and being able to take on the stigma and being able to defend yourself and have your voice. Hunter, he talked about his experiences at the clubhouse, had a wealth of experience and resources. He talked a little bit about the challenges that our recipients who are blind face and how that plays into the job market. So I thought that was an interesting aspect. And then Judy Summers, obviously having served with her on the board and all of us knowing her passion and her level of commitment that she's gone through as a parent, and excited to be able to work with her again, with her on this committee, even though she's no longer on the board. So it was just an impressive array of candidates. We spent a lot of time talking, going through all of them, and it wasn't not necessarily an easy choice to get down to these three, but I think we got three really good, solid candidates to bring before the board for recommendation. Thank you.
Thank you. Are there any other comments or questions? I just wanted to say before we call the vote, it's good to have Judy back, assuming this passes. Not gone and not forgotten. And I think if my memory serves me correctly, that would mean that we have two past board members when this passes on the board, in addition to John Paul as our liaison, because Lois Schulman is on the REC, and as well, that would be Judy as well. So a very strong board. Plus our regular members that very much are very big on the advocacy space and on recipient rights. So I doubt that there's a stronger RRAC committee anywhere in the state. So.
Yeah, thanks, Jonathan. I think, it's interesting if Judy gets voted on, it's so nice to have her long history of what has happened over the years related to stigma, discrimination, lack of rights, and just, that incredible wealth, because you can't forget the past so that you don't, repeat in the future. And she has just a really fabulous way of sharing that information in a way that's easy for all of us to understand, and it shows the passion and knowledge about the topic.
All right, thank you. If there's no other comments, I will call the question. All those in favor of this motion to approve for the three members to the RRAC, say aye.
Aye. Aye.
Any opposed? The motion carries. Sheila, you have a comment?
Yeah, I'm sorry. We need a roll call vote on that.
We do? All right,
Yeah.
Let's do a roll call.
Okay. Dr. Tom?
Yes.
Dr. Hans,
Yes.
Mr. Furman,
Yes.
Ms. Namie Dyer,
Yes.
Ms. Newman, Dr. Guadalupe,
Yes.
Ms. Root,
Yes.
Mr. Cohen,
Yes.
Mr. Lindemeyer,
Yes.
Ms. Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Landsman.
I vote yes as well.
Thank you.
Question, I think I see Judy on there. Judy, would you like to make a statement now that you're a member of the RRAC?
Sure, why not? Never
you.
miss an opportunity to make a comment, right? I am absolutely thrilled at the opportunity to continue to explore and advance my commitment to the rights of the people that are served by OCHN. It's an equalizer, it is a door opener, and it is so empowering for the people that we serve to not only know their rights, but to fully understand and use them. Thanks.
Thank you. And I welcome your return to active now that you've had 2 months off for good behavior.
Yeah, I've aged less.
Thank you, Judy.
Thanks, Jonathan.
All right. Next on the agenda is other business. Oh, I'm sorry, I jumped one. Consent agenda. So we have 2 items on the consent agenda, and I'm looking for a motion to approve the consent agenda as it stands with the approval of the board meeting notes, minutes, and the needs assessment and strategic plan summary survey. Is there a motion to approve the consent agenda?
So moved.
All right, thank you. I wasn't sure who made that motion.
That was
Is it
Dennis
Dennis?
Cowan.
It was Mr. Cowan.
Oh, it was? All right, thank you. Is there a second for that motion?
I'll second, John Paul.
Thank you. Since it's a consent agenda, there is no discussion. We're just looking for a roll call vote for this for these items.
Mr. Torres,
Yes.
Ms. Bernard,
Did you say Miss Bernard?
I did.
Yes.
Oh, sorry. Yes.
Yep. Mr. Lindemeyer,
Yes.
Mr. Cohen,
Yes.
Ms. Root,
Yes.
Dr. Guadalupe,
Yes.
Ms. Newman, Ms. Namie Dyer,
Yes.
Mr. Furman,
Yes.
Dr. Hans,
Yes.
Dr. Taub,
Yes.
Mr. Landsman.
I vote yes as well. It sounds like we have a unanimous consent. So the board meeting minutes have been approved, but as well, and more importantly, the needs assessment and strategic plan survey has been approved. So I'm looking forward to seeing that survey get published. You'll have to keep us posted, Nicole. Next item on the agenda is other business. Many of you on the board have probably seen your emails recently about registration for the CMHA summer conference. It's virtual again this year from June 14th to June 17th. So it's morning sessions, 9 a.m. to 12:30 each day. There are 24 different breakout sessions. So it will be, I would say it would be very difficult to find something of that you would not find interesting with the topics. So please let Sheila know if you plan on attending this. Again, it's virtual. My insight is that the fall conference that's up in Traverse City will most likely not be a virtual. That will be an in-person conference, but we'll see. But this summer conference, June 14th through the 17th, is definitely virtual. So please let Sheila know if you plan on attending. Next item on the agenda are board reports. First on the list is the SUD Oversight Policy Board. And Eric, if you have a report on that. Oh, you know what? My apologies. I'm looking at the displayed agenda and it's showing RRAC. So John Paul.
Okay, thank you. We had our Recipients' Rights Advisory Committee on May 6th at 4 p.m. We opened the meeting and celebrated Amit's contributions to the committee. He has finished his term on the RRAC committee. So we're recognizing him for all of his years of service, his passion, and the contributions that he made to our committee. Then we went into closed session after waiting on any public comment, which there was none. Went into closed session to spend most of the time in our committee reviewing the applicants that were brought before us and additional applicants that also came before our group. Very qualified candidates. I was impressed with the caliber of people that applied for the position, and equally as impressed and excited about the 3 that we ended up selecting. Like I said before, it wasn't easy, but there was a lot of talk and back and forth amongst our group determining who we thought was best and for what reasons. After that, we came back to the meeting and made the recommendations for Judith Summers, for Hunter Parker, and then for Miguel Quintero to serve on our committee that we brought before, the recommendation that we brought before the board today. Our next Recipients' Rights Advisory Committee will be June 6th. And at that meeting, we will review the site visit audit tool. I have a presentation on the site visit audit tool, a boardable presentation given by Sheila Barrett, and then our obtain education on guardian supportive decision making will also be given, and then policy review on PR 15.1, exchange of confidentiality, in RR 17.1, fingerprinting and photographing. So it's a public meeting. You're welcome to come and sit in and view and see what we talk about. And was mentioned before, we now have 1 active board member and 2 former board members on that committee, and a whole lot of passionate people serving for our those that we serve within this community. Thank you.
Thank you. Are there any questions for John Paul? John, I do. John Paul, I have one question for you.
Yeah.
With Amit, he's termed out, I know, but is there, do you know, or Vicky Suter or Gene Fender know if he's able to rejoin that committee in another year, or is he completely termed out?
That was, I'm sorry, John Paul.
Oh, go ahead, Vicky.
He completed his 2nd term. Our policy requires that a member is once they finish their 2nd term, they cannot reapply for a 3rd term for 6 months.
6 months. All right. Thank you.
Yeah.
All right. Thank you. Any other questions for John Paul? All right. I know Malkaya is out, so the next report would be the Oversight Policy Board with Eric. Please.
Thanks, Jonathan. I am going to give a report on our April 28th, 2021 meeting. This is, I think, the minutes that we approved earlier. My report really comes out of the minutes that were approved from this meeting. So I'm just going to highlight a few things. But one thing I do want to mention is that the OCHN staff that was present at this meeting. I'm going to list their names: Christina Nichols, Sherry Cook, Megan Phillips, Emily Springer, Bradley Sharp, Tradina Taylor, Dana Lessenby, Nicole Lawson, Rachel Rhodes, Kalana Ali, and Sheila Barrett. And one of the reasons why I want to recognize that they were at this meeting is, over COVID, over the past year and few months, the work that the staff has done at OCHN, it's a lot of it's hidden work. People are, unfortunately, we're in our houses and there's a ton of work going on. It's difficult to manage our way through this, and I just, it's so important for us to be recognizing the work that the staff members do. And there's just an example of, here's a meeting, a quarterly meeting, and the work that they do to advance the organization that we don't see is incredibly important. So I just wanted to recognize that. The second thing that I would mention is that we have 2 new board members that were introduced. One is Janet Jackson, and the other is Michael Speets. I hope I'm saying his name correctly. And they were appointed by the Oakland County Commissioners. They are Oakland County Commissioners, and they are joining our board. So it's great to have their perspective on the Oversight Policy Board. The next thing is we had during COVID, we had a number of applications. We've had, I don't know if you guys remember, but we've had 4 openings on the board, and we have had applications, but we haven't really had a chance to go through a proper appointment process. And so we're going to look at what the appointment process is. We're going to go through that process and look at those applications that came in, and we'll be holding special meetings as we get other applications, and hopefully we'll be able to make those appointments as we move forward. I had given, at the meeting, I had given a brief update on the SUD vaccination rate. I would say that Dana really added most of the information that the board needed to hear about. If you remember, when we talked about populations and the vaccination rate, that the SUD community was really a bit behind. And it's great to report that OCHN is applying for funds for vaccine education, advertising, hosting clinics at provider locations to boost the vaccination of the individual SUD population. I know that at that meeting we had talked about that. I don't know if we've received the money and we're starting to do that or not. But I would just encourage everyone to look at the minutes from the past meeting. There's nothing else, I don't think, that in particular I think that we need to highlight from that meeting. There are still additional board positions that are available. So I think, the other thing is that Kalana gave an update, and we are going to be doing some updates of bylaws. With that, that's all I have to report on.
All right. Thank you, Eric. And thank you, John Paul, for your 2 reports. Next item on the agenda is the director's report. Dana, you have the floor.
Thank you and good evening, everybody. I am very happy to be here. I just want to take the time. Thank you, Mr. Lindemeyer, for recognizing the staff and our team's hard work. It's really important that we be present in all of the committee meetings as much as we can. Sometimes we have conflicts, but we try to make it there because those issues are very important, especially as you recognize and we recognize the need for individuals receiving SUD services and treatment get access to the vaccine. So we're working with the county as well as the health department, and Dr. Posios is working very closely with our core providers to see if there are opportunity to even do mobile clinics so that we can spread and give access to that vaccine. So as we make progress, we hope to update this board that we can do that and change the numbers, because that is a part of my report today. And actually the numbers are still not where we want them to be, but that is a goal of ours, is to increase the numbers. Currently, of the 64 people, only 64 people receiving or actively receiving SUD services have received the vaccine. And that says at the time of my report, my hope is that that number continues to go up, and that we're going to actively do some things that we can do to make that number go up. So with that, I also want to thank everybody for taking the time to really recognize May as Mental Health Awareness Month. I'm really grateful for the people we serve, the staff here and the provider network, and our community partners for their efforts to celebrate the successes of people living with behavioral health challenges. And later on, either this evening or tomorrow, Christine Burke will provide some information on some events that are coming up as we close out the Mental Health Awareness Month of May. And so she'll send out that information so you can take some time to appreciate some of the events and things that we've done to celebrate mental health awareness. So we're using stories of hope. Hopefully folks will see those stories and they'll inspire people to ask for help and seek out services, or to refer somebody because you know about the services and the supports that are available through Oakland Community Health Network. The other thing I wanted to talk about today is really taking the time to protect the publicly funded public mental health services in Michigan. And I think most of you know now that there is some attempt, again, through Senate leaders, to privatize Michigan's public mental health service delivery system. It really is a revised version of the boilerplate 298 language that was first introduced in 2016. And every year since, my hope is that one year we can go without and we can focus on making really the improvements we need to make to the public behavioral health system and closing up some of the gaps. But we continue to work on. We know this is a disguised attempt to, again, promote integrated and physical health care, but we already do that in other different ways, such as our CCBHC, which is our Certified Community Behavioral Health Homes, and our behavioral health homes, or I'm sorry, CCBHC is Certified Community Behavioral Health Clinics. And we use a lot of acronyms, but I get them mixed up. But this is what some of the things we're already doing with our core providers who are all co-located with our FQHC Honors Health. So again, it's an attempt to take the public funding away from the public mental health system and give it to the for-profit private Medicaid entities. So I'm hoping that you will join me and advocate for the public mental health. We are the safety net. And if we don't, we're at risk for losing specialty mental health services such as employment, housing, jail diversion, peer supports, and public oversight, and so much more that we're held accountable for that the private system does not do. So again, take this time and continue to educate our legislators. We've been having many, many meetings with different stakeholders throughout our community, including the county exec's office and his team, as well as the Board of Commissioners. I presented to the Health and Safety Committee today, and it was well received with many offers of support and help. So we're hoping to build on that support and work very closely with the members of that board, the Board of Commissioners. So there is going to be information that come out, and I know Mr. Landsman shared information about how to fill out and contact our legislators through a template that's provided through the association. So I really encourage you to work with us to support the public mental health system. So as Jonathan talked about earlier today, we are looking for your input for our needs assessment. This annual survey is really important to what we do. It's information that's gathered through this process is used to develop our service delivery priorities for the upcoming fiscal year. So the plan really does reflect the views and the needs and wants expressed by people we serve, their allies and family members, community partners, and of course, members of our network. So we want to make sure we get your information, we get your feedback about what you want to see for the community and the individuals we serve. So later on this evening, that link will be provided to the board. And so we encourage you to fill that out and send it back to us as quickly as possible. There are other options that you can take advantage of, such as if you want to call in to our customer service and complete the needs assessment. Those are options that will be made available to individuals that do not have access to a computer or the ability to do that survey or needs assessment on their phone. Again, I want to talk about our service priorities and really the need for us to really maintain vital crisis and emergent care coordination is one of the top things that I'm working on now, and the team is working on as well. We really want to make sure that families, children, individuals we serve know that we're here in the community. And I hope by now that you've seen our commercials. Our commercials will evolve and eventually really show people receiving services and showing that they're just like every one of us. So we want to make sure that you have the information there to see what kind of things we're doing. We also want to be recognized in the community as a reliable resource to support people when they need it the most. So a lot of my time has been spent in really going out and talking about the public mental health system and what we can do and how people can access our services. The other thing that's truly, truly important too is to work with our community partners. That includes our core providers, our crisis provider, and other SUD providers, any provider that we want to cultivate those relationships and really build a relationship of accountability. And that works both ways, so that we're providing the support and technical assistance and anything that our providers need, so we can have the outcomes that we want for the people that are receiving services and support through us. So we also think it's very important to align our priorities with those of the Michigan Department of Health and Human Services. And by doing that, we are engaged in providing those integrated services. Like we said, we've been involved with Honors Health. We also have the certified community behavioral health homes. We also do the behavioral health homes. And I'm really proud to say that our team and their hard work working with our core providers, we have the most individuals registered to receive services through the behavioral health home than any other PHP in the state. So we have really looked at ways to get people in touch with services, even if they knock on the door and they don't meet the traditional criteria for community mental health. There are ways that we can continue and connect them with services through one of those options. OCHN also needs to be an innovative leader. So as we face some of the threats of privatization, my goal is really to help our team be prepared for those threats, and also looking at how we better serve individuals, looking at social determinants of health, listening to the voices of the people, the children who are waiting for services. Again, that's another area that we need to continue to look at. Integrated healthcare systems for children that really look at crisis and access to services. We know there's a gap there, and we want to make sure that when we're working with families, and we truly are working with families when we're working with children, that we're looking at children and adults in a holistic way. So we're looking at their physical health care needs, their mental health care needs, economic, vocational services, social community supports, and community living supports, and then also transportation. I think some of us take that for granted, possibly, but transportation for individuals we serve is critical so that they can access and go to the services, and then also enjoy some of the fun things we all love to enjoy. Especially now that the weather's getting warmer, we want people to be able to get out and do the things that they like to do. And we know working very hard, and I believe Mr. Lindemeyer brought this up earlier, and Dr. Guadalupe also talked about our NCQA accreditation, and our team is working extremely hard to maintain that accreditation. So once you get it, it seems like that's the easiest part. It's really challenging, so we're proud of it, but maintaining it is also very critical. So one of the funny things about joining this team is that I didn't hear it talked about too much because they had just gotten it, for one, but also one of the things that I was really happy to hear about, they don't talk about it too much because they have embedded it and integrated into our day-to-day operations. And that's really what NCQA is all about. So I'm really proud that our team is not just getting to things and checking a box to say we got it. They are actually working and doing the day-to-day work to maintain it. So that makes me really proud to be a part of this organization. And finally, I do want to talk about our opportunities for service expansion and development. I think you're all aware now that the county, Oakland County, will receive a lot of funding through Americans Rescue Plan. And so part of our work is really being involved in helping to identify priorities. So I was honored to be asked to join a newly formed strategic planning work group established by the Oakland County Executive Office. And this group is comprised of other community leaders that are charged with identifying, prioritizing, and finding solutions to challenges facing Oakland County residents in the wake of COVID-19 and other public health issues. So one of the things that we're working on in the subgroup that I'm also working with is mental health and physical health disparities, looking at diversity, equity, and inclusion, looking at housing, employment, and criminal justice reform. Those are just some of the topics, and I'm really happy to see that we have a seat at the table. I think in the past, we really have been limited in our engagement and what we've been able to do with the county, but being really asked to participate and then even being able to participate in a subgroup means that we can access resources and funding and support that we may not have had the opportunity to get in the past. So I'm excited to come back to you when we see some of that stuff come to fruition, which I'm hopeful it will. Just to review the COVID information very quickly, the numbers haven't changed too much. I am happy to say that we see our numbers of individuals being vaccinated has increased slightly. I think there was a pause with the Johnson & Johnson, a little bit of scare and hesitancy, but I now know that we've done a lot in terms of working with the county health department to make sure the individuals we serve and their family members and the people that work with those individuals actually get access and receive the vaccine. So the numbers are there in my report. But the other thing that I'm happy to report, and this is the final thing, is that we have not had any reports of loss of life due to COVID since April. So that's a big thing. And I'm happy to say we haven't lost any lives in the last month or so. In the last count, there were 36 lives lost, which, you know, is a big deal. But to say we haven't lost any additional lives is, I think, something to start to celebrate as we begin to open back up. And that is the end of my report. And I'm ready to take any questions you may have or feedback.
Are there any hands? Any questions or comments? Yes, John Paul.
Dana, are we doing any vaccination on site anymore, or are we just directing people that want to get vaccinated to a location?
Now we're directing people to a location. We actually, Dr. Pozios and I had a conversation with the Oakland County Health Department doctor, and he talked about some of the concerns in having access to the vaccine, and especially with Johnson & Johnson and some of the things that have come to the news. But also, I think people have sort of, you know, not been so pressed to get it from us or to get it in these large venues, because now you can go to your pharmacy and other ways that you can get it. And Dr. Pozios, thank you for raising your hand because he can add on to that.
Yeah, I just wanted to update the group and let them know you mentioned the need to focus on getting our SUD population vaccinated. And I do want to mention that we are making progress in that. Genoa, the pharmacy, has conducted a vaccine clinic at Meridian. And tomorrow, actually, we'll be conducting a vaccine clinic at St. Mary's. And so that is something that we feel very strongly about, making sure that we are meeting folks where they are to try to get as many people vaccinated as possible and close the gap between our SUD population and our larger behavioral health population. So hopefully by the next meeting, we'll have some more positive news to report.
And I happily stand corrected. Thank you, Dr. Pozios.
And another question. So with there seems to be a gap or deviation between the normal population we serve and the SUD population. Do we know what that's from, or is you mentioned the Johnson & Johnson vaccine and that pause there, and are we doing anything more aggressively to try to tackle that, or?
I don't know if there's I think part of that is a small part of this, the Johnson & Johnson. I just think maybe too, that when individuals are in treatment, they're not leaving out to go to the clinics. And what we found is it's better to go where they are to give them that support and give them the access. And I don't know if Dr. Pozios wants to add on to that as well, because I know he's actively been working with the health department and Genoa Pharmacy to make sure that we're going where the need is.
Yeah, and I'm also working closely with Christine Burke and Christina Nicholas. I don't want to speak for them, but I know Christina has mentioned that there are several theories as to why the SUD population appears to be more hesitant, or at least has not been vaccinated. Some of it may have to do with concern about needles and possibly triggering use, and some other reasons. But I think that hopefully that will, we'll be able to provide the necessary support for folks to, to meet that challenge. And I know Christine, is working on some community outreach efforts to help, raise awareness of this issue and reach out to the SUD population and encourage them to get vaccinated. If I see her name here, so if she'd like to speak, I can turn it over to her.
Dana, did you want me to add some information?
Absolutely. Thank you, Christine.
So we actually, my team is working closely with Christina to plan a marketing campaign specific for individuals with substance use disorders. We've emailed the CDC and the department as well. We do know that this people with substance use not getting vaccine is not isolated in Oakland County or Michigan. It's across the country. So we'll be putting billboards up that are specific for people with substance use disorders. We are creating posters to put in all of our service sites, our SUD service sites. We are also going to be mailing information cards about the vaccine to people we serve with substance use disorders anonymously, in terms of we won't be identifying individuals by name. We'll just be putting to the address. So anything we can do to create awareness in that community. We also met with the peer recovery coaches to gain any information and insight that they could share with us in terms of making sure we're using the right messaging, the right language, and ask for their help in identifying specific reasons people may not be getting the vaccine that we can incorporate in our planning.
Oh, okay, that's good information. Thank you. Just another follow-up question. Is there a preference that we're choosing, or I guess that's really up to them, but like, because I know the Johnson & Johnson is like the one shot that you get done, but I read numbers that there's a population that gets one vaccination that may get the Pfizer, the Moderna, but then they don't get the second one. So we're just directing them to a site though, right? So wherever, and then wherever they can get it. I know that's usually the best advice, is to go wherever you can get it, right? And I know it's more in abundance now, so.
Oakland County, actually, their health department, if you call and ask them about a site, they will ask you, or you can ask if there's a preference, and they can point you to where you want to go, if you want Moderna or Pfizer or the Johnson & Johnson. They actually have that information, so you can actually request to go to one of those sites, as opposed to one that, they just point you to the nearest vaccine site and you may not know which one they're giving on that particular day.
Oh, that's good to know. Yeah, because Because I think that was one of the things that I was getting at was that sometimes people who are a little bit more hesitant about getting it, they're just saying, you know, I would like to prefer to get the Johnson & Johnson so I can just get it done with. So, okay, but in that instance, if they're going through Oakland County, they can choose which one. Okay, thank you.
But if they don't, like if they're working with Genoa, you know, we let them know which one is going to be available. We wouldn't just say, just take it because it's here. We educate, let them know which one is available that particular day or at that particular location that we're at.
Okay, thank you.
Eric, you had a question or comment?
Yeah, I was just going to report anecdotally. You know, I go to my AA home group has 2 meetings. So fortunately, we're able to meet again in person. So we meet on Mondays and Fridays. And there's people there that are cross addicted, and you know, addiction of every substance. You know, people come to the to our meeting, and I was surprised at the percentage of people that have been vaccinated. Even a lot of people, you know, heroin users and what, you know, people that were used to using needles, they have been vaccinated. So I was really happy to hear that, because I know that we had heard, you know, I know that is an issue that's been discussed. So I was pretty happy with that. But the other thing to report also is this relapse because of the pandemic is real. People are coming back to our meetings, and they just, it was such a struggle because Zoom meetings, you know, alcoholics find a lot of different, you know, substance abuse, people with addiction, you know, they have a lot of, you know, a lot of issues with why this method or that method doesn't work. So people really struggled with isolation and Zoom meetings, and we're finding a lot of people are coming back that had been out for, you know, they had been clean for 2.5 years or, you know, what have you, and they just couldn't make it through the pandemic. So, you know, we got, you know, thank God that, you know, we can actually meet again outside, and that we can start to at least have people come in person, because they need that. A lot of people need that person-to-person, in-person touch in order to maintain their sobriety, and they just weren't getting that, you know, with Zoom meetings. So I just wanted to let the group know.
All right, thank you. Dennis Cowan, you had your hand up. And you might be on mute now.
Can you hear me now?
Yes.
Dana, what is the status of with our various group homes with residents going back to their vocational centers or work centers or volunteer arrangements? Can you shed any light on that, of what is being developed in that regard, as we enter this next phase of COVID?
You know, and honestly, that is something I need to get deeper follow-up in, but I know that there's been a lot of concern about individuals not being able to go to their vocational programs and receive those really important services. And so we've been working with our vocational providers on a regular basis, almost, I think it's weekly or every other week, that we meet with them and talk about some of the challenges, because I think that is a group of providers that have been hard hit and that we have continued to support. So our hope is that as the community opens back up, they can resume some of those programs and services. We had some open back up and have to close up again. So we're hoping that now that some of the restrictions have decreased, that they'll be able to resume those activities and those very important jobs they had in the community and those other things. But I would love to get back with you and give you an actual number instead of talking narratively. So let me do that, and I will send it back to the group in this board through Boardable tomorrow. I can get that information to you, because that is something, you're right, we need to follow up on that, and I don't have that information in front of me.
Okay, thanks.
Thank you. Thank you, Dana. Is your report complete?
Yes, it is.
All right, thank you. Next item on the agenda is our second public comment. If we have anyone.
We did not have any public comment this evening.
All right, thank you. The next item is board member comments. Sheila, if we can go through roll call.
Sure, Dr. Taub.
Okay, I wanted to add on to what Alan Boulder said and what Dana said too. Alan brought up we have all sorts of talking points against the boilerplate 298, and we've been using them successfully, but these are all mostly new legislatures. But Alan came up with some really good new ones, and they are, first of all, we are enthusiastically embracing integration of behavioral and mental health services. So at least they know that we're not trying to stop that, because we are doing that. Lots of integration efforts are going on, and the target should be for integrating mental and physical health at ground level, and absolutely, definitely not at the funding level. We're not against integrating mental and physical health care. We're enthusiastically embracing it, and it should be at ground level, but we definitely are against doing it at funding distribution levels, because you're dealing with not privatization, but with profitization. You're dealing with somebody whose own internal expenses are running 15-16% that they report, and they don't even report it like we do, and ours runs 5 or 6%. So we're absolutely for everything they want, except for the funding part. And those are really good talking points, in addition to all the old ones we've been using. And my theory, when I was on the board at CMHA, is, and I've been through this with regular medical practice, things that the government and legislators wanted to do, and insurance companies, dragging your feet and stringing things out and negotiating and making things last a long time puts the issue up in front of the public, and everybody starts to see the deficiencies in their side, and pretty soon it goes away. We were going to have pilots, and they fell apart. And I don't remember the guy's name that used to be CEO at Macomb County, but he always said 298's dead. It's never going to get anywhere, and especially if we can stretch out the process long enough for everybody to see that. So anyway, Alan Boulder is probably going to contact everybody with talking points. He did already send out the voter voice, the automated thing. You can contact your legislators, and I did that 2 weeks ago. And I know from experience from legislators that some of them just count them. So if they get a whole bunch of emails and automated things, and there's 9,000 of them, that's what they. If you're not going to talk to them individually at their office hours, that's still effective, just sending in an email or a letter. So keep up the advocacy, and I agree with Dana and Alan Boulder that that's important. And everybody have a nice week, and I hope to see a lot of you in person next Thursday night, a week from Thursday night. That's all I have.
Thank you. Sheila, who's next?
Sorry, I couldn't get unmute. Dr. Hans?
I have no comment. Thank you.
Mr. Furman?
Yes, I just like to again, I don't think he's on the line still, but just I'd like to thank Kevin and the presentation on Sacred Heart tonight. Just really impactful and really positive given what we've gone through in the past year and just the message of giving back. Also, really enjoy the fact that Judy is back serving the community in a official capacity. That's wonderful. And everyone stay safe. And again, thank you to all the staff for the work they put in on the presentations. Have a great night.
Miss Namie Dyer.
Yes, thank you to Kevin and Keely for their presentations. I really enjoy all of these stories that inspire hope. I feel like it's just a really nice fresh breath of fresh air, especially given everything going on over the last year. So thank you for those presentations. And Dr. Taub, thank you for all of that additional information about 298. I think that's really helpful to hear. Otherwise, everybody have a good night. Thank you.
Miss Newman. Dr. Guadalupe.
No comment. Thank you.
Miss Root.
Yeah, I would just like to echo Eric's acknowledgement earlier, the OCHN staff, and how amazing you all are and your dedication to accomplishing our mission. Thank you for all that you do. And I did really appreciate the story tonight. I'm personally grateful for Sacred Heart's programs throughout the state because I had a family member participate in one of those. So I know how impactful their work is. And that's all. Everyone have a great evening.
Mr. Cohen.
Okay, no comments this evening.
Mr. Lindemere.
I agree with what Dr. Taub said. Thank you.
Miss Bernard.
Well, I want to thank Kevin for sharing his journey. And also, you know, there's a lot of funding that goes to Sacred Heart, and it was good to hear from them and appreciate their presentation along with the staff's presentation. But I also want to particularly thank Dana. I think that your report and your enthusiasm for what you're doing is really showing the partnership that you're creating with, you know, Oakland County Health Department and just really getting the word out there on who OCHN is. And I think it's making a difference. I think it's making a difference for, you know, even that you have a seat at the table with the new funding coming down from the federal government. So I just wanted to do a special shout out and thank Dana. Have a good evening.
Mr. Torres.
No comments. Thank you.
Mr. Landsman.
Thank you. I just want to remind folks that, yes, our board study session is a week from Thursday. Again, we're now operating under hybrid come that meeting. So if you're going to attend in person, please let Sheila know. Actually, let Sheila know either way, whether you're remote or in person, so we can accommodate everyone. I haven't made up my mind yet if I'm going to be in person yet, but I look forward to seeing you guys then. Thank you. If everyone else has made comment at this point, I would call the meeting adjourned. Thank you, and we'll talk to you later.
Thank you.
Good night.